Well, very often women are busy taking care of everyone else but themselves, and that can be detrimental for a woman's health.
I do believe it. I think it's so true. So today, if you're a woman and you have time, you're invited to the For Health's Sake It's Time for You seminar at the Baptist for Women Health Center. And that is where we find our Jewel Hillary. She's going to be live for us. There she is in just one moment to tell us what's going on out there.
Good morning, Brandon and Katina. The health seminar that we're going to get ready to learn a little bit more about is specifically for women, and it's absolutely free. Now, the women that participate will be able to get some one-on-one advice from a doctor and tips from A to Z about women's health. Now, to tell us a little bit more and to discuss some of the topics that are likely to come up in today's seminar, I'm joined by cardiologist Dr. William Harper. And Dr. Harper, if we could just start out by asking, what are some of the risk factors that women need to really watch out for when it comes to their heart health?
In this area of the country, this is the hypertensive capital of the world, so high blood pressure is certainly something everybody needs to be aware of. And your blood pressure can be checked even in your local pharmacy if you don't have access to another resource. And in this area, the cholesterol intake, our diets are very fat saturated. And in our country also, especially this area, the issue of diabetes is very common.
Okay. And you mentioned before we came on air, you said people need to work out more and eat less, something pretty simple but hard for a lot of people to do.
Well, simply stated in as few words possible, we need in this area to eat less and move more. We are a population that really do overindulge, and we're carrying much more weight than we need to as a population, particularly in this region of the United States.
And in terms of heart disease, isn't that one of the #1 deadliest diseases for women? And how can women help prevent heart disease?
It is. There are many diseases that are well publicized and supported by organizations, but still cardiovascular diseases in women is the leading cause of death. And we've made progress since the 1990s, and we're making more progress, but it is still the #1 cause of death. So the issue before us is to get these ladies in, get them screened for their risk factors, and then try to move on those risk factors before they get into trouble.
All right. Well, thank you so much for all of that information. Thank you for joining us this morning. And if you are interested in coming to the health seminar today, it's at the Baptist for Women Center. It begins at 11:45 and will run until about 12:30. And as I've mentioned in our previous shows, if you aren't able to make it, Baptist does, they do have these free women's health care checklists, which describe pretty much all of the screenings and exams that a woman needs to begin receiving beginning at the age of 20. So it's pretty easy to read and understandable. And if you would like some more information, you can call Baptist at 601-948-6262, and you can talk to a nurse about any health topic that you have. Katina and Brandon, back to you.
All right, thank you, Jewel. Thanks for the preview of today's seminar.